Hello everyone, my name is Richard Longland. I'm the founder of the Arthroplasty Patient Foundation and your host for The Patient Advocate, a new monthly show focusing on all kinds of interesting health issues, often problematic health issues. So we're lucky to have my new dentist here today, Dr. Jeff Korba, who I met just recently. I'm happy to say that he is now my favorite dentist in the world because he focuses on newer innovative treatments to really take care of our mouths. So he's been kind enough to take about the next 25 minutes to focus on some of my perhaps difficult questions. And let's get right into it. So if you could, Dr. Korba, tell us a little bit about your practice and perhaps some of the basics like how big your practice is, and then we'll get into some of the more differentiating aspects of what you do. So.
Okay. Well, my practice is in Lynnfield, Massachusetts. We've been there going on 16 years now, and I'm the only dentist there. We have 2 full-time hygienists and a total staff of 7 people. So it's probably a traditional dental family practice. Nowadays we see kids as early as 6 months to a year for kind of get a sense of if there might be any developing concerns, and just to educate the parent on how to help take care of things and things to watch out for. We believe in building on a relationship, with a patient. We want people to come and be patients with us for a long time. And we want to be their dental office, so I guess in a nutshell, that's pretty much it.
Okay. So I know that you have some rather unique ways of approaching oral care, and I really did my homework to find Dr. Korba. I was really on a mission to find a new dentist because I realized that my old dentist really was old in terms of the techniques he was employing to treat cavities and things of that nature. So tell us a little bit about how you're different in terms of some of the methods that you're using to help people get well.
Mm-hmm. Well, first off, I kind of consider myself almost like a health coach for the patients that come to our practice. As a dentist, there's some who argue that we might be one of the most important healthcare practitioners that any person will see for a number of reasons. One is not everybody goes to their physician regularly, and a well-trained dentist can help people figure out if they might have diabetes, sleep apnea, heart disease, and so forth. And we're there to educate and become their health coach, to let them know what issues they may be facing from a medical standpoint, but also certainly from an oral health standpoint. And these days you really can't separate the two. Actually, I think it was the most recent Surgeon General who said that there is no good health without good oral health. And that certainly is very true. The connections just keep expanding as to what poor oral health can contribute to.
Right, so let's get right into that. Fast forward a bit here. In my film, Why Am I Still Sick? The Silent Role of Biofilms in Chronic Diseases, the main tenet is that biofilms are unfortunately underdiagnosed or just not diagnosed at all. So can you talk a little bit about your perspective of biofilms in the mouth? And don't pull any punches. Why is it that it seems a lot of other dentists are not really treating and eradicating biofilms?
Well, biofilms, first of all, are responsible for the 2 main diseases that we treat, both bacterial diseases, periodontal disease, and caries or decay. Both are biofilm diseases. Dentistry has always kind of been on the forefront of prevention and trying to do things from a preventive standpoint. But the things available to us nowadays, and for those who are really searching as the knowledge builds as to what a biofilm is and as a dentist these days, you can spend all of your time just filling holes and doing root canals and repairing teeth. But one of our keys, and certainly any dentist on the forefront, is even taking prevention to another level by figuring out how we can eliminate the biofilm to the best of our ability, or give the patient the tools to do that, and first off, help them to do it. And there are a number of different techniques and materials and recommendations that we'll give for the patient to take home, but also things we can do in the office.
Well, let's talk about that. Let's get real specific. Talk a little bit about, if you will, biofilm and how it can be eradicated with xylitol, which is a natural simple sugar. You use ozone in your office for, I guess, cleaning the actual water lines, but you use ozone, I guess, in a couple different ways to actually do dental cleaning. Is that right?
It is, yes, that's exactly right. Ozone, it really seems to be, one of those miracle, let's say, drug. It's a naturally occurring. It's oxygen with an extra oxygen molecule, so it's O3. And it actually permeates the membranes of the cells and the bacteria, and basically causes them to explode, implode on themselves. So it's antimicrobial, antiviral, antifungal, and all of those things are in our mouths. So and unfortunately, oftentimes in our water lines. And so, doing our best to make sure that we're doing everything we can to make sure we're not contributing to the issue, is how you alluded to treating the water lines. For instance, the water that we use in the drills, we treat those water lines with a number of products, but ozone in particular, and then it's ozonated water that's running through that. So that's going to go through that water line and hopefully kill the microbes and bacteria that are in there, and then keep that safe. And then we also use it in our ultrasonic cleaners. When patients come to us for a cleaning, we're oftentimes using only ultrasonic, which is a vibrating tip with a water spray, which is ozonated water. So between the, to truly remove a biofilm, you want to do it mechanically and from an antimicrobial standpoint. So the actual vibration is going to help do it mechanically, and the ozone, the ozonated water, is going to help to kill the actual bacteria.
And does it actually, how does it get rid of the biofilm? Because the biofilm is a sort of a slimy mix that can have all kinds of bacteria, fungi in the kitchen sink. So does it actually, vibrate the structure of the biofilm loose so that the ozone can be, or I should say the biofilm can be completely removed and sort of swished out of the patient's mouth? Is that right?
It's the biofilm is a very smart, living, growing organism. We tend to think, oh, we've got a couple bacteria in there, but we have hundreds of bacteria in our mouth, some good, some bad. So in essence, it's actually, yes, the vibrating tip, the ultrasonic tip, is actually mechanically breaking up the biofilm, and then the ozonated water can actually cause it to break up as well by, the vibrating tip can remove the polysaccharides, the glue, so to speak, that's holding things together, and then the ozonated water can get in there and really wreak havoc.
And xylitol, I discovered years ago. I met and interviewed Dr. Lon Jones, who founded a company, Clear, that's spelled with an X, based on this simple sugar. And they now have products that are used in mouthwash and toothpaste and things of that nature. So you have this, and you use this in your dental clinics, is that right?
We use it for different ways. We will use it in the cleaning. We'll use it in the prophy paste. We'll also recommend it, as a rinse, as a toothpaste, containing xylitol, chewing gum. Believe it or not, here's the dentist actually recommend for our patients to chew gum.
Mm-hmm.
And in actuality, the studies show that if you have 5 different exposures to xylitol throughout the day, that you can significantly decrease your chances of getting decay. It can adversely affect the bacteria, see it, because typically for a cavity to form, and the xylitol most actively works against the bacteria that causes decay. The bacteria sees it as a traditional sugar and takes it in, as bacteria will. Generally in forming a cavity, it'll take that bacteria in, and as it processes it, it releases acid, which breaks down the tooth. Xylitol is taken in as that sugar, but it gums up the works and the bacteria wind up dying. And it's all about finding the equilibrium of good to bad, taking bad bacteria out and bringing it down, and suddenly now you've got a balance, or a preponderance of good, healthy bacteria, and suddenly now you can start to win that battle against. It also works against the bacteria causing periodontal disease, but certainly in particular to the battle against cavities.
Mm-hmm. Well, it almost seems too good to be true. Here we have a sweetener, and you can use it in your everyday food, and of course xylitol is found in fruits and vegetables in small amounts. But and this is probably getting a little bit into the weeds and the minutia, but there's always some sort of controversy about fluoride. And I think justifiably so, since my research has shown that as far back as 60 years ago, Dr. Gerson proved that it's injurious to the thyroid and other organs. So do we actually have a choice now as an informed patient to say, I don't want fluoride, at least in your practice, can we use the xylitol or other products?
Yes, absolutely. We still use fluoride. I certainly know of all the research that you mentioned. And I don't know, exactly, the truth out there. I do know that fluoride can be beneficial to the teeth and as far as preventing decay. But again, absolutely now with these other choices, it can allow us to say, okay, maybe we don't need the fluoride. We have products that actually contain a milk protein and the calcium and phosphate in it that you can place on the teeth as a varnish like you would with fluoride. You can brush with toothpaste without any fluoride and containing xylitol. So a number of options are available, and so we like to inform our patients what those options are and let them make the informed decisions.
Good, good. Well, that's great that you are innovative enough to offer these kinds of options to, let's say, just discriminating patients or patients that care about these things. So if we can just back up a little bit and go to a super important topic that you touched on, there's this notion of total health. The flip side and sort of negative aspect of that is if someone doesn't have good dental health, how can that impact their overall health? For example, rheumatoid arthritis, all kinds of other conditions that have clearly been documented. This is no longer pie in the sky. So can you talk a little bit about how an unmanaged mouth can lead to sort of direct channels to the bloodstream and some of the more serious consequences from a circulatory system perspective?
Sure. Now we're talking more about the bacteria that contribute to periodontal disease, and there's probably like 6 really main ones that are the bad guys, so to speak. And those are the ones that tend to get down into the deeper layers of that biofilm and get down underneath the gum. And once that starts to happen, that's like getting a splinter in your skin. The body reacts, with its inflammatory process. It sends increased blood flow to the area, cytokines, all kinds of inflammatory mediators to battle that bacteria. And consequently, you get swelling in the blood vessels and oftentimes bursting of those blood vessels. And here's an open communication for the bacteria to get right into the blood system, the arteries. Also, theorization that, people are swallowing this bacteria in just another way, that they could be inhaling those bacteria. Certainly, I know in your talks talking about inhalation types of diseases, and there's probably some of those that are caused from oral bacteria. Certainly, there's no doubt that cardiovascular disease, I always have trouble with that one.
Atherosclerosis.
Thank you, sir. And coronary artery disease. They've done studies where they look at the plaque, the bacteria lining the arteries, and compare it to the bacteria taken off of the teeth under the gums, and you can't tell the difference. And because the same bacteria that are found in the mouth are found, in the heart sometimes with endocarditis, certainly in the coronary arteries and the rest of the vascular system. One in particular, one bacteria, Porphyromonas gingivalis, PG as it's known, if that is present, it has been noted in literature that it can increase the likelihood of cardiovascular disease by 12 times. So pretty significant bacteria that we're talking about that, it's been proven over time and again. The one thing that's come out is that they aren't given a causal relationship, which is, kind of the key as far as, the medical world is concerned. And part of that is because the definition of what is periodontal disease is a little unclear out there. Different people have, different ideas, and so it's not clear cut, like an x-ray is going to tell you whether you have it or not. And but for those who know, there's no doubt that there's a definitive, significant connection that inflammation is really a killer.
Well, among the various societies and specialty groups, is there sort of a general definition that we can latch onto here, what periodontal disease is? I mean, does it always involve some kind of, microbial pathology or not?
Yeah, it doesn't really have to. It is like the depth of the pocket. When the bacteria gets into the gums start to pull away. The bone starts to recede, and so a pocket develops. So, one thing is, how deep is that pocket? And that can be clinically by probing with an instrument and measuring, or looking at an x-ray, you can see some loss of bone. You can see bleeding on probing when you're actually checking. If you actually see bleeding, that's a sign. But as far as a significant or determinant type of bacteria being present to be able to be called periodontal disease, that's not the case.
Okay, but yet we see sort of free market solutions, companies offering other testing services, for example, looking at the actual oral DNA left over from microbes. There's pH. So two-part question, do you offer these kinds of testing services, and do they help you as a diagnostician sort of hone in on what the right prescription would be for your patients?
Absolutely. We use those, and I can think of a case just recently that my hygienist came to me and said she was almost in tears because when we first saw this patient present, we thought he's going to lose a number of these teeth. And we did relatively conservative but therapeutic treatment, and got in there with our ozone and ultrasonics and cleaning. Let me step back. What started that story was we tested him not only for what types of bacteria he had, but also we can also test a genetic predisposition to the inflammation and his body's response to it. I think it's maybe 30% of people have interleukin-1 gene that makes them a hyper responder when it comes to inflation. And in periodontal disease in particular, that's very important because actually the body's response to that bacteria will actually be destructive in trying to beat the bacteria. It'll destroy bone and collagenase is an important factor in that. So this patient actually happened to be a hyper-responder, and also had significant bacteria. One thing that does is it allows us to hone in on, I'm not a big proponent of antibiotics, but for a short period of time while we were treating him in a 1 week period, had him on a particular antibiotic that we knew worked against this certain group of bacteria that he had. And then also we got him started on a subclinical, I think it's kind of almost similar to the Marshall's protocol, a subclinical doxycycline, which interacts and affects the collagenase and blocks that production.
And was that applied locally, or is that systemic?
That's a systemic,
okay.
20 milligram
Mm-hmm.
tablet daily, and so blocking the collagenase, basically blocking his hyper-inflammatory reaction. And then by using the ozone and giving him actually ozone oil to take home and work with, now we've changed the biofilm genre in his mouth, and at that point we instituted probiotics. I know you're a big probiotic guy.
Oral probiotics.
Yeah, and so now we're basically putting in good bacteria to help those good bacteria keep the bad bacteria at bay. And he just came back for his 3-month follow-up, and that's when she thought she was going to be in tears, because there was no bleeding on probing, which is the clinical sign. I mean, the health that he showed
in 3 months.
Yeah, well, really, it happened in the actual treatment. The hard part about periodontal disease, it's never cured, and that's, why we're always, to be able to test the bacteria that he had and to know that we eliminated it, at that point. Typically what happens is it just gets right back in, but if you get that probiotic going and you mess with that environment in a good way, you can start to take, hopefully, control.
So I think a lot of people are wondering, well, why the heck can't you get rid of it? Is that a tough answer to come up with, or I mean?
Yeah, I mean, just because it's so prevalent, I mean, it's a multifactorial scenario. You can become infected from your spouse. That the belief is that it is a transmissible disease. So the bacteria are always out there. And again, I'm a firm believer that some people are more susceptible, like so many diseases, than others. But the things that we now have in our arsenal certainly gives us a lot better chance of somewhat eradicating it, but again, giving the patient a much better chance at keeping it under control. But that's why building a relationship with the patient, because their part is really the most important. If they're not doing the things at home that we're recommending, then it will reoccur.
I think some people are very surprised when they first hear that these periodontal diseases can be infectious. So one of the things I sort of joke about when I present on the biofilm topics is don't kiss your pets. And people think that's funny, but I'm being completely serious. So even the CDC just a couple of years ago put out a public news release that said, don't let your pets sleep with you. But what they really meant to say is, don't put yourself in an environment where you're going to be exchanging body fluids with your pets. I know that sounds kind of silly, but
yeah.
People need to understand the infectious transmission process. It's not just between people; it's between animals. So that's very helpful. I'd like to take the last 3 or 4 minutes to address something that frankly really bugs me, no pun intended. One of my difficult challenges with the Arthroplasty Patient Foundation is really helping people understand the importance of not just the dental systemic link, but the importance of really taking good care of their mouths, especially before they go into major surgery. And the reasons why I'm so sensitive to this is, firstly, I don't see anyone really ringing that bell out there. Secondly, in my documentary, I described that my mycoplasma pneumonia infection probably came from the intubation process in my spine surgery. I'll never know, but it made me sensitive to these areas of need. So maybe we can just kind of review and think through the additional steps, all the different steps. I want to put together a checklist, if you will, for all the things that patients should consider before going into a hospital for major surgery.
Probably checking the record of that hospital as far as staff. And I don't mean people who work there, infections, but yeah, certainly things that they can do. Certainly should see their dentist. Certainly, if it's cardiovascular disease involved, related to diabetes, to have a top-notch level of oral health, removing any teeth that might be infected.
How far in advance? Are we talking months, or help us out with the timing there?
Yeah, I would say that like this patient, certainly within a month, if the patient's committed, and even if they need significant work, you probably can get it done in a month's time. If there's not a lot of work, then obviously a shorter time would be necessary. But if given at least a month leeway ahead of time, to be able to help them to eliminate any active disease, and in particular periodontal disease, and then to give them the necessary tools to keep that level healthy so that they don't have any bacteria. The possibility of using xylitol nasal spray, and such, to get that as healthy as can be.
And what about toothbrushes? I mean, we see new advertisements every day for this kind of toothbrush or this kind of toothbrush. I mean, there's ultrasonics, there's this one, there's the good old-fashioned ultra soft toothbrush. So help us do the common things uncommonly well.
Yeah. I'm a believer that, if you're good with a manual toothbrush and floss, and you're working at it and you know what you're doing, that should be sufficient. Are there a number of professional brushes out there that can actually, to some extent, help do the job for you? Absolutely. The Oral-B is a good one. The Sonicare, that's vibrating, pulsating. The belief is that it can actually burst the biofilm, so it's really the mechanical removal, as long as you're getting to every surface of every tooth, whether it be with brush and or floss or interproximal or inter-tooth cleaners, but then using stuff like xylitol or the probiotics, or things to, again, work with the pH, which is a very important factor here, and the bacterial level, and keeping it under control to the best of the patient's ability.
Well, I think that's an excellent wrap-up, and I want to thank you again for being a thought leader in this field and being my favorite new dentist.
Well, it's a pleasure, Richard. I've really, I've learned from you just, so much as well, and I appreciate the mutual back and forth.
Great. So for you and for others that are watching, we're actually going to push this segment up to my YouTube channel. Just look for me, the Arthroplasty Patient Foundation, on that channel. And the Woburn Public Media Center has been kind enough to repeat this show every week for a 1-month period. So for any additional information, just contact me. The contact information is on the screen, or you can just phone Dr. Korba's clinic and talk with him directly. So thank you all for tuning in to The Patient Advocate. Peace and good health to you always.